Local anesthesia is a safe and effective way of managing pain. When used in dentistry, local anesthesia involves the injection of an anesthesia solution adjacent to the nerves that provide sensation to a region of oral cavity where treatment will be delivered. The anesthesia solution temporarily prevents the propagation of nociceptive nerve impulses, thus allowing for the pain-free delivery of dental treatment. Local anesthesia in the dentistry can be given as either infiltration or blockade anesthesia.
Anesthetic use. The local anesthesia may be given before a dental procedure like tooth extraction for numbing the area temporarily. It causes a temporary loss of sensation, including pain, without depressing the level of consciousness. How are dental local anesthetics used? When used topically, dental local anesthetics can manage pain from toothache, canker sores, sore gums or throat, mouth or gum injury, where benzocaine can be applied to the mouth or gums to numb nerve endings. If you have a sore throat, just dissolve one lozenge slowly in the mouth every 2 hours as required. When given as an injection, local anesthetics are used for numbing rather than pain management. Some dental procedures that utilize local anesthetics include: first is root canal treatment. The anesthesia is injected to remain awake during the procedure without feeling any pain because of the anesthesia. Preparing teeth for crowns also need to inject anesthesia into your gums so you won't feel pain. Treating gum disease also need to use anesthesia to avoid patient discomfort.
Local anesthesia is local state of loss of sensation without loss of consciousness in circumscribed area of the body due to a depression of excitation in the nerve endings or an inhibition of the conduction process in peripheral nerves. Properties of an ideal local anesthetic agent. The properties that are desirable in local anesthetic solution are as follows. First, it should be non-irritating and produce no local reaction to the tissue to which it is applied. It should not cause any permanent change in the nerve structure. It should cause minimal systemic toxicity. Fourth, it must be effective when injected into the tissue and should have sufficient penetrating properties to be effective as topical anesthetic when applied topically to the mucous membrane. It should have a short time of onset if possible. The duration of action must be long enough to allow completion of procedure.
Bennett in 1974 has added some properties which are as follows. First, it should have enough potency to give complete anesthesia without the use of harmful concentrated solutions. Second, it should be relatively free from producing allergic reactions. It should be stable in solution and readily undergo biotransformation in the body. And lastly, it should either be sterile or capable of being sterilized by heat without deterioration.
Instruments for local anesthesia. The equipment necessary for the administration of the local anesthesia includes dental syringe, dental needle, and dental cartridge. The dental syringe, it is the vehicle whereby the contents of anesthetic cartridge are delivered through the needle into the tissue of the patient. Next slide is the dental needle. The dental needle permits a local anesthetic solution to travel from the cartridge into the tissue surrounding the needle tip. Most needles used in dentistry are stainless steel, and they are usually pre-sterilized and disposable. So the next one is dental cartridge. The dental cartridge is a glass cylinder containing the local anesthetic solution. So in the next slides, you'll be shown a few examples of local anesthesia used during tooth extraction.
Good morning, everyone. I am Marinella Duhan, and this time I'll be sharing to you how to administer the local anesthesia in tooth extraction. So there are three types of anesthesia that are commonly used: the local anesthesia, the sedation, and the general anesthesia. but the local anesthesia is the most common type of anesthesia that are used for extraction. So these are the most used dental local anesthetic agents: the lidocaine, articaine, prilocaine, and bupivacaine. But the most commonly used nowadays is the lidocaine. To administer the local anesthesia, first instruct the patient to slightly open the mouth and relax the jaw and cheek muscle. Again, retract the lower lip laterally to delineate the mucobuccal fold. Now the administration close to the tooth being anesthetized towards the apex of the root. Make sure the aspiration of the needle before depositing the full volume of local anesthetic to prevent the intravascular injection.
Local anesthetic in tooth extraction complications includes needle breakage, persistent anesthesia or paresthesia, facial nerve paralysis, trismus, soft tissue injury, hematoma, pain on injection, infection, sloughing of tissues, post-anesthetic intraoral lesions. These complications from local anesthetic in tooth extractions are rare but possible. Infection or hematoma at the injection site may occur. Proper dosage, technique, and patient history assessment are crucial to minimize this risk.
The side effects of local anesthetics. Anesthetics are the most used drugs in dental offices, and it's very rare for patients to have a negative side effects to them. The rare side effects associated with anesthetics include a hematoma. A hematoma is only developing if the injection needle hits a blood vessel. A hematoma is characterized by a clot of blood in the surface that looks like a bruise. Second is an increased heart rate. That explains why a tooth extraction is not possible if you already have a high blood pressure. This increases the risk of a heart attack or cardiac arrest. Numbness outside the area that was targeted. This can affect the way your face looks for a few hours. It can also prevent you from blinking properly and decrease other facial movements. Nerve injury due to injection needle striking a nerve. This can lead to pain and numbness that lasts several months until the nerve heals.